Alrighty, class. We're going to go into the Chapter 14, which is the lymphatic and immune system. This comes right after the blood. And so we're going to identify the structures and analyze terms related to lymphatic and immune systems, learn the basic terminology, combining forms, and other word parts related to these systems, recognize terms describing pathological conditions, identify lab tests, clinical procedures, abbreviations, and apply your knowledge to understanding medical terms in their proper context. So what's lymph? You should definitely know what lymph is. Lymph is clear, watery fluid that surrounds body cells and flows in a system of lymph vessels throughout the body. Make sure you know how to spell it too, L-Y-M-P-H. It originates in the blood. It's rich in lymphocytes and monocytes, flows in lymph capillaries and blood vessels, flows through lymph nodes and lymphatic organs, liver, spleen, thymus, and nodes, and absorbs lipids in the intestine. Tonsils, if you've had your tonsils removed, they're aggregate lymphatic organs. Lymphocytes and monocytes and lymph organs protect the body against foreign invaders. Okay. So what's the real purpose of the lymphatic system? So this is definitely something, it transports proteins and fluid that have leaked back into the bloodstream. Lymphatic vessels absorb lipids from intestines and transport them to the bloodstream. Lymphocytes and monocytes protect the body by mounting a cellular attack on foreign cells and organisms. Now, what's the structures of interstitial fluid in lymph capillaries? Include blood capillaries, lymph vessels, interstitial fluid, tissue cells. So if you look at this right here, okay, so basically you have the blood from the arteries, and you have blood, and during that time you're going to get a little bit of leakage that occurs, right? And during that time, basically it's the lymphatic tissue that will pick up the blood, the interstitial fluid right in here, and it gets returned via the lymph. Okay, so that's how that interstitial fluid is there. And so the lymph is a nice little intertwined network that will pick up some of the excess fluid right in here. Okay. Now, you want to make sure that when you have swelling and inflammation, you don't use those two words interchangeably, because swelling is bad, but inflammation is part of the healing process. So when patients say they want to stop inflammation, you want a little bit of inflammation. We don't want chronic inflammation, but a little bit of inflammation starts the healing process. But swelling is excessive fluid that's right here that the lymphatic system can't pick up, and we want to pump out the excess fluid. Okay. So lymph originates from the blood and filters out tiny blood capillaries into the spaces between the cells. The fluid that surrounds body cells is called interstitial fluid, which passes continuously into thin-walled vessels called lymph capillaries that course through tissue spaces. Lymph passes through larger lymphatic vessels through clusters of lymph tissues, finally reaching larger lymphatic vessels in the upper chest. And lymph enters these large lymphatic vessels, which then empty into the bloodstream. So here's the blood. So here's the heart. Right? There's the blood. It goes into the arterioles. Okay, there's tissue cells, there's blood capillaries, and then what's going to happen is then when the lymph capillaries are going to take this to lymph nodes, and then they're going to filter it back into the veins. So again, the lymph is responsible for filtering out. Okay, so it's part of the way that you cleanse the body. And one thing that we've always talked about is you've heard these scams about liver cleanses. Remember, the job of the liver is to cleanse, so you don't need to pay any extra fluid or any diet to do a liver cleanse. The liver is meant to cleanse. The lymph is meant to cleanse. Your body is there to do that. Okay, so drinking a special drink will not cleanse anything. Okay, lymph capillaries, lymph vessels, lymph nodes, you have them in your neck, you have them in your armpits, you have them in your chest, you have them in your intestinal tracts, you have them in your lumbar region, you have them in your groin. Now, you definitely know what macrophages are. They phagocytose foreign substances, But then B lymphocytes, which are B cells, they produce antibodies. They mature in the bone marrow, so make sure you know where B lymphocytes mature. And then T lymphocytes, which are T cells, they attack bacteria and foreign cells. And make sure you know where they originate. They originate in the thymus gland. So basically the B cells will mark them and the T cells will kill them. Okay, so you want to know that, and you want to know where these guys mature and where they originate. The spleen destroys old red blood cells, as found retroperitoneal, right behind the stomach and slightly inferior. Filters microorganisms and other foreign material out of the blood. Activates lymphocytes during blood filtration. Activated B lymphocytes, B cells produce antibodies. Activated T lymphocytes, T cells attack foreign materials. Stores blood, especially erythrocytes, RBCs, and platelets. So it does a lot of things, but it's one of the most commonly injured and ruptured organ after a car accident. And you guys know Magic Johnson, he's HIV positive. He actually has no traces of HIV except for in his spleen, because the spleen is responsible for filtering microorganisms and other foreign material. So you're thinking, well, then he should just remove his spleen. No, you never want to introduce anything or open anyone up that doesn't need to be, because you can have a whole host of other issues. So he's doing fine. He's lived almost 28 years with HIV, which is unreal. He's probably one of the longest living patients with HIV. Well, it tells you that money can buy you a lot of things. Now the thymus gland is right here. Make sure you know how to spell that. Provides immunity in fetal life and in early years of growth. Makes cells immunocompetent in early life. Early removal from an animal impairs its ability to make antibodies and produce cells to fight antigens. So the thymus is actually very large in infants and children, but by the age of 12, 13, 14, it actually shrinks quite a bit, and you don't see it. So in adults, you'll see a very small thymus, but the thymus gland in early age definitely provides immunity in fetal life and early years of growth. The immune system itself are leukocytes, neutrophils, monocytes, and macrophages. The lymphoid organs are lymph nodes, spleen, thymus gland, tonsils, adenoids produce lymphocytes and antibodies. What is immunity? Immunity is the body's ability to resist foreign organisms and toxins that damage tissues and organs. You can get that natural or adaptive. So let's talk about the difference between the two. So natural immunity is resistance present at birth, not dependent on prior exposure to an antigen. So you can get that. You already have natural immunity. You can get, and how do you get that? That's phagocytosis, macrophages, and natural killer cells. You have those already built in. Okay. Now, adaptive immunity is the body's ability to recognize and remember specific antigens in an immune response. So those are your lymphocytes, T and B cells, antibodies produced after exposure to the antigen, memory, meaning second exposure, vaccination, immunoglobulins, and maternal antibodies. So all this, okay, that's why drinking mom's breast milk is very good, because you would get the mom's antibodies. Vaccination is good because it introduces your body to a small amount of that virus, so that your body, if you really do come in contact with it, then your body will be able to recognize it and tackle it right away. Memory, meaning if you had the one virus before, let's say, you might get a second time, but your body already knows about it, so they'll be able to fight it off. And then you have the T and B cells. So that's how your immune system, adaptive immunity, works. So the B lymphocytes are responsible for humoral immunity. That means they originate in the bone marrow from stem cells. B cells produce antibodies after exposure to specific antigens such as viruses and bacteria. And the B cells mature into plasma cell that produces antibodies called immunoglobulins to block the effects of antigens. Make sure you know how to spell immunoglobulins and which ones are immunoglobulins, which would be IgG, IgEA, IgB, and IgE. The T lymphocytes are responsible for cell-mediated immunity. Doesn't involve antibodies. So the cytotoxic T cells attach to and directly kill the antigen. Other T cells secrete cytokines, which are interferons and interleukins that help cells respond to antigens. The helper T cells promote antibody synthesis by B cells and stimulate other T cells. And then you have suppressor T cells, regulatory T cells or TREGs, inhibit B and T cells and prevent them from attacking the body's own good cells. Now again, it's not an immunity class, it's not a physiology class, so you don't need to go into too much detail about interferons and interleukins and et cetera, et cetera. This is a medical terminology class, so you just need to be aware that, hey, there are some T cells. The cytotoxic ones are known as T cells. And where do they mature? So that's why it's good to listen to these lectures and say, okay, what do I need to focus my attention on? Because in physiology and anatomy, of course, we would go into how these would work, but in medical terminology, we just need to know how to spell these things and where they're located. Dendritic cells. Dendritic cells are a macrophage derived from monocytes. They recognize and digest foreign antigens. They present antigens on the surface of to stimulate B and T cells. They transfer immunity by exposing dendritic cells in culture, then transfuse them and get them to stimulate T and B cells. Now, what are some immunotherapy examples? You can do monoclonal antibodies that have multiple copies of cells or genes that kill tumor cells. Passive immunity. Vaccines, you've heard of vaccines. We're all waiting for the coronavirus vaccine. That will contain antigens from the patient's tumor cells, stimulate the patient's own T cells to recognize and kill the cancerous cells, activate immunotherapy. Transfer immune cells. In bone marrow transplantation, T lymphocytes from a donor can replace a patient's immune system, and new cells that recognize tumor cells as foreign and kill them. So immunotherapy seems to be kind of the new treatment for cancer. You can do that for lung cancer, breast cancer, and basically what happens is all the tumor cells, they have this marker, this PD-1 marker, and basically what happens is your own immune system cannot recognize it. So what immunotherapy is doing is basically it's saying, okay, we're going to expose those PD-1 markers, and your own immune system is going to be able to recognize these tumor cells, and then they're going to be able to attack it. The problem is every different type of cancer has their own variation of PD-1 markers. So basically you have to go into every different type of cancer and find where that marker is and be able to expose it. So that's why immunotherapy is great, but there's a lot of work that needs to be done, unfortunately. All right, so what are the vocabularies? Adaptive immunity, adenoids, antibody. So adaptive immunity is ability to recognize and remember specific antigens and mount an attack on them. Adenoids are massive lymphatic tissue in the nasopharynx. Make sure you know what adenoids are and how to spell them. Antibody is proteins produced by B cells to destroy antigens. What's an antigen? What's an axillary node? What's a B cell? Antigen is a substance that the body recognizes as foreign, evokes an immune response. Okay, so antigen is a substance that body recognizes as foreign. Axillary nodes are lymph nodes in the armpit. B cell is a lymphocyte that matures into a plasma cell to secrete antibodies. Now again, antibodies will fight off the antigen. So this is just vocabulary that you need to memorize. What's cell-mediated immunity? Cervical nodes, complement system. A cell-mediated immunity is T cells that respond to antigens and destroy them. Cervical nodes, lymph nodes in the neck region. That's why when you go to the doctor, he'll kind of feel right around your neck and see if your cervical nodes are tender. If they're tender, then it could mean that you have some kind of infection, because your lymphatic system is bringing all that into the lymph nodes so it can fight it off. So that's what they're checking. The complement system, proteins in the blood that help antibodies and kill their target. Cytokines, cytotoxic T cells, and dendritic cells. Cytokines are proteins secreted by cytotoxic T cells to aid in antigen destruction. Cytotoxic T cells are lymphocyte that directly kills antigens. And a dendritic cell, antigen-presenting cell, shows T and B cells what to attack. Okay, so it says, okay, these guys shouldn't belong here. We need to attack them. Those are dendritic cells. We have helper T cells, CD4, humoral immunity, and immunity itself. The helper T cells are lymphocyte that aid B cells and stimulates T cells. Humoral immunity, B cells produce antibodies after exposure to a specific antigen, type of adaptive immunity. And immunity itself is body's ability to resist foreign organisms and toxins that damage tissues and organs. Again, in physiology and anatomy, you're going to go into the details of how humoral immunity works, adaptive immunity works. Not too worried about the process of that. I need you to know how to spell these things. I need you to know what they do in general, but we don't need to go into detail of how everything works. That's an anatomy class and that's a physiology class. You need to know what immunoglobulin is, how to spell it, and what they are. Immunotherapy, inguinal nodes. So immunoglobulins are antibodies secreted by plasma cells in response to the presence of an antigen. Immunotherapy is the use of immune cells, antibodies, or vaccines to treat or prevent disease, mostly cancer. Inguinal nodes, lymph nodes in the groin region. What are interferons, interleukins, and interstitial fluid? Interferons are proteins secreted by T cells and other cells to aid and regulate the immune response. Interleukins are proteins that stimulate the growth of B and T lymphocytes. Interstitial fluid is fluid in spaces between cells, becomes lymph in lymph capillaries. Lymph capillaries, and lymphoid organs. Make sure you know what lymph is and how to spell it. That's a thin, watery fluid within lymphatic vessels and collected from tissues throughout the body. We don't like excessive lymph. Lymph capillaries, tiniest lymphatic vessels. Lymphoid organs, lymph nodes, spleen, and thymus gland. What's a lymph node, lymph vessel, or a macrophage? Lymph node is a collection of stationary solid lymphatic tissue along lymph vessels, and if they're sore, that can mean that you have either a bacterial or viral infection. Lymph vessel, carrier of lymph throughout the body, and a macrophage is large phagocyte found in lymph nodes and other tissues of the body. What about mediastinal nodes, mesenteric nodes, monoclonal antibody? A mediastinal node is lymph nodes in the area between the lungs and thoracic cavity. A mesenteric node is lymph nodes in the mesentery. A monoclonal antibody is an antibody produced in the lab to attack antigens and to destroy cells. So make sure you know what that is. Natural immunity, para-aortic nodes and plasma cells. Natural immunity is a protection that an individual is born with to fight infection. That's different from adaptive immunity that you get that with vaccines and moms and second exposures. Para-aortic nodes, lymph nodes near the aorta in the lumbar area of the body. Plasma cells, lymphocyte that secretes antibodies, matures from B lymphocytes. You have the right lymphatic duct and the spleen. So the right lymphatic duct, vessel in the chest that drains lymph from the upper right part of the body, empties into the large neck vein. You have the spleen, that's organ in the left upper quadrant of the abdomen, behind and inferior to the stomach. Basically, it destroys worn out red blood cells, activates lymphocytes, and stores blood. Suppressor T cells, and tolerance. Suppressor T cells, TREG, lymphocyte that inhibits the activity of B and T cells. We don't like those, right? T cells, T lymphocyte that acts directly on antigens to destroy them or produces chemical toxins to antigens. And then tolerance is the ability of T lymphocytes to recognize and accept the body's own antigens as self or friendly. Okay. Now, when you have a autoimmune disease, sometimes your own immune system will attack your own cells because of a low tolerance. And sometimes certain autoimmune diseases that come to the surface there's no cure for them because it's your own body fighting them. Thoracic duct, thymus gland, and tonsils. Thoracic duct drains from the lower and left side of the body, empties into the large veins in the neck. The thymus gland is a lymphoid organ in the mediastinum that's larger in kids and fetuses that help to react to foreign cells. As an adult, it shrinks. Tonsils are masses of lymphatic tissue in the back of the oropharynx. a toxin and vaccination, and a vaccine. A toxin is poison, a protein produced by certain bacteria, animals, or plants. A vaccination is exposure of an individual to an antigen that provokes an immune response that will destroy any cell within an antigen and will protect against infections. And a vaccine is weakened or killed microorganisms, toxins, or other proteins given to induce immunity to infection or disease. Again, if there's a flu vaccine, you've had all the vaccines as a child, and then we're all, like I said, waiting for the coronavirus vaccine. Which lymphatic lymphocyte originates in the bone marrow and transforms into a plasma to secrete antibodies? That would be the B, and that's helper T cells. Okay. The formation of antibodies and lymphocytes after exposure to an antigen is B, humoral immunity. Not natural, that's what you're born with. Okay, so formation of antibodies and lymphocytes after exposure, that's called humoral immunity. So those that have been exposed to coronavirus, they'll have humoral immunity. Okay, so now let's look at the combining forms. Okay, so if you look at immuno, that means protection. So immunology is the study of protection. Immunoglobulin is a protein that acts to protect the body by destroying antigens. What about lymph or lymph? So you have lymphedema, which is swelling of tissue due to accumulation of lymph. Lymphopoiesis, which is the formation of lymph. Okay. What about spleen or spleen? Okay. Splenomegaly is enlargement of the spleen. Splenectomy would be removal of the spleen. What about thymus? That would be a thymectomy, would be removal of the thymus gland. And tox is poison, so toxic is pertaining to poison. Okay. What about ana? Ana would be again, or anew. Okay. And then inter is between. So interstitial fluid would be pertaining to fluid that lies between the body cells and eventually becomes lymph fluid. All right, so what are some disorders of lymphatic and immune systems? You've heard of AIDS, acquired immunodeficiency syndrome. Basically, it destroys the T helper cells, CD4, opportunistic infections, malignancies. We'll talk about Kaposi sarcoma and wasting syndrome. Opportunistic infections with AIDS. So remember, most people don't die of AIDS themselves. They die of secondary complications or opportunistic infections like candidiasis, cryptococcus, cryptosporidiosis, cytomegalovirus, CMV, herpes, histoplasmosis, mycobacterium avian, intracellular, pneumocystis, pneumonia, toxoplasmosis, and tuberculosis. So you can get these, and then they can lead to secondary infections, and then more complications occur because HIV and AIDS, they're attacking the immune system, so you cannot fight regular infections. What's RTI? Reverse transcriptase inhibitors. They inhibit a viral enzyme called reverse transcriptase. So those are the drugs to treat that. Protease inhibitors inhibit viral proteolytic enzyme, and combination of RTI and protease inhibitors called the HART. Gilead Sciences, which is based in San Dimas, is one of the forerunners of HIV treatment. There's a lot of them out there now. What's an allergy? Allergy is an abnormal sensitivity acquired by exposure to an antigen. Ranges from allergic rhinitis or hay fever to anaphylaxis. Other allergies: atopic dermatitis, asthma, urticaria, which are hives. What's lymphoma? Malignant tumor of lymph nodes and lymph tissue. Hodgkin lymphoma, Reed-Sternberg cell, non-Hodgkin lymphoma, follicular lymphoma, large cell. Again, we don't need to go into the mechanism of what is a Hodgkin lymphoma, how does it get, just make sure that what a lymphoma is and the two subcategories. What's multiple myeloma? That's a malignant tumor of bone marrow cells. Thymoma is a tumor of the thymus gland. Just make sure you know how to spell these. Sometimes they're associated with myasthenia gravis. Patients may have other autoimmune disorders such as lupus and rheumatoid arthritis. Stagings of non-Hodgkin's or Hodgkin's lymphoma. You have stage 1, involvement of single lymph node. Stage 2, involvement of 2 or more sites. Stage 3, disease of both sides of the diaphragm, may include spleen. And stage 4 is widespread involvement of the liver, bone, marrow, lung, and skin. So what is malignant condition associated with AIDS? That would be Kaposi sarcoma. What are some of the lab tests that you might see? You have a CD4 plus cell count, measure the number of CD4 T cells, helper T cells in the bloodstream with patients with AIDS. When your blood count, number count drops below 200, that's when HIV becomes full-blown AIDS. The ELISA test detects anti-HIV antibodies, Western blot given as follow. What is immunoelectrophoresis? Separates immunoglobulins IgG, IgM, IgE, IgA, and IgD. What's the viral load test? Measures the amount of AIDS virus, HIV in the bloodstream. What's a CT scan? X-ray imaging produces cross-sectional and other views of anatomic structures. These X-ray views show abnormalities of lymph organs such as lymph nodes, spleen, and the thymus gland. And here's some abbreviations. AIDS is AIDS is acquired immunodeficiency syndrome. CD4 plus cell is a helper T cell. CD8 plus cell is a cytotoxic T cell. CMV is cytomegalovirus. Crypto is cryptococcus. ELISA is the enzyme-linked immunosorbent assay. GCSF, granulocyte colony stimulating factor. GM-CSF, granulocyte macrophage colony stimulating factor. A HAART, H-A-A-R-T, is a highly active antiretroviral therapy. Histoplasmosis, HIV is human immunodeficiency virus. Make sure you know that. HSV is herpes simplex virus. IgA, IgD, IgE, those are immunoglobulins. Make sure you know that. Interleukins, KS means Kaposi sarcoma. MAI is mycobacterium. MOAB is a monoclonal antibody. And NHL is a non-Hodgkin lymphoma. PCP is pneumocystis pneumonia. PI is a protease inhibitor. RTI, reverse transcriptase inhibitor. SCID, severe combined immunodeficiency disease. A TREG is a regulatory T cell, and toxo means toxoplasmosis. Again, to emphasize, this is a medical terminology class. Just make sure you know how to spell these, spelling, and what some of the meanings are. Okay, you don't need to know the physiology behind it, but you do need to know a general anatomy and what these spellings are and basic categories here. Okay, all right.